am from Peru, so I moved here when I was 5, first person to go to college, and I came here to Vanderbilt for my undergrad, and I majored in Latin American Studies and Psychology. I'm very familiar with the program as it is. Vanderbilt as a whole was an awesome school, and so that's what led me to apply here for graduate school. Healthcare has always been something that I wanted to do, but nursing just seemed to be the right place because nurse practitioners really do take their time with their patients. We just don't treat what we see, we treat the patient as a whole. We are taught to treat patients across the spectrum. So this specialty was very appealing to me because we see 13 and up, and that was awesome because that's where you see the most changes in disease process. It's a great population to work with because you see that transition from teenagehood into adulthood. And if you're lucky enough to follow them, you might follow them into older adulthood and kind of see that spectrum of care as they go on with their lives. I was already very familiar with Vanderbilt's reputation as a top academic school. But then they had this accelerated program, which was very appealing to me as a student who was young and also wanted to really get a good education, but not exactly spend so many years doing it. My faculty and the speakers here are up to date on everything, and not only that, we're also really technologically advanced, and I feel like we're once we graduate from here, I'm going to be very equipped to really handle the challenges they face as a new nurse practitioner with new technology and new information, and I feel very, very ready to handle that. As an adult gero primary care nurse practitioner, you can do anything. We are very aware that you don't exist in a bubble. We are sent out to work with the community. I've already gone to Costa Rica and Panama and loved it. I triaged in pueblos in small cities, and so I would love to continue doing that in a more underserved population that's mainly Spanish speaking. I definitely see myself getting my DNP. I really want to be able to research the Hispanic community and how over time, how they developed disease-wise, how they developed here living in the United States. And so there aren't a lot of Hispanic nurses who are advanced in their degrees, but the DNP itself really is all about research, and I really love that. Nurse practitioners are needed everywhere. As the healthcare arena is changing, we are in more demand, and really you are going to have not only employment opportunities for life, but really enriching experiences as well.